Last year, Governor Janet Mills proposed and got passed sweeping legislation that strengthens access to abortion services in Maine. Now she and the legislature are being asked to pony up more money to pay for those services. Good evening, everyone. I'm Amanda Hill.
And I'm Brian Iacono. Dozens of advocates were at the State House today to support a bill that calls for millions in funding for family services. News Center Maine's Caroline LaCour spoke with providers who would benefit if the bill passes and with lawmakers who don't approve of what they do. Caroline?
Hey, Brian and Amanda. Yeah, after Roe v. Wade was overturned by the U.S. Supreme Court last year, many Mainers brought up concerns that they're concerned that a domino effect could limit reproductive health here in Maine. Now advocates are pushing for one bill that could fund additional family planning resources well into Maine's future.
So as a doula, I have seen ways in which healthcare has gaps.
As a doula, Hannah Lord is the right-hand woman for many before, during, and after childbirth, and she's always advocating for her clients. But she's concerned about what the future holds when it comes to reproductive health care.
As an aftermath of the Dobbs decision, I think it means it needs to be that much more vital that Maine puts more security in place.
That's why Lord and dozens of other advocates are pushing lawmakers for more funding for family planning resources at a time when access and help aren't always guaranteed.
That's why it's more important than ever. Before that, Maine steps up.
Proposed by State Senator Theresa Pierce, an act to improve women's health and economic security by funding family planning services would set aside more than $3 million of the state's general fund each year for family planning resources.
But Title X funds are tangled in a political tug of war, and funding from the state has become stagnant for nearly a decade.
Organizations, including the non-for-profit Maine Family Planning, say if the bill passes, it could help clinics that offer reproductive care stay open more often, offering more services to more people, especially in underserved rural areas.
These are all clinics that are open one day a week, which is really not enough to provide access to the kind of sexual and reproductive health care that our patients need.
But some lawmakers bring up concerns that funding will go towards abortion care and that the money isn't needed by providers like Planned Parenthood, claiming those providers already receive state and federal funds.
90% of what they take in is pure profit. They make plenty of money to fund all these services on their own. All we're asking as Republicans for them to take care of that matter on their own.
Now, backers of the bill expressed to concerned lawmakers that these funds would not cover abortion care. However, Republicans who voted down that bill last year in the Committee of Health and Human Services tell me that they just can't really trust that sentiment. Live in Augusta, Caroline LaCour, News Center, Maine.
Caroline, thank you.